There is a common treatment that is normally associated with kids and often with religious or cultural practices, and that is the circumcision. I want to explain to you how the circumcision can be a proper surgical treatment that is needed for certain conditions, also in adult patients. Circumcision is the classical and typical treatment of a condition that is called phimosis. Phimosis is the inability of uncovering the glans penis so that the foreskin remains trapped in a closed position. This can be something patients are born with and is called congenital phimosis, or something that is developed later on in life and it is called acquired phimosis. They both share the same treatment, that is circumcision, but the acquired phimosis most of the times is the result of a chronic inflammatory disease that has a very complex Latin name, balanitic sclerotic obliterans, but most of the times is known as BXO, the acronym of that. This is a condition where, because of a continuous inflammatory process, there is a deposition of a lot of collagen, and that leads to a progressive closure of the foreskin that eventually is unable to be retracted anymore. There are attempts of treating it with some potent steroid creams, but most of the times the final and resolutive treatment will be a surgical procedure, that is the circumcision. It is done under local anesthetic or local anesthetic plus sedation, or under general anesthetic, depending on the fitness of the person and depending on the comfort and of the fear of pain or of the fear of anesthetic that each person may have. The diseased area is completely removed, and that is important because sometimes patients want a partial circumcision or want some more conservative approach, but if there is a disease, this must be removed, otherwise the operation is not successful. So the diseased area, that is a cylinder of skin, is removed and the two ends are stitched together. There are several techniques that are in place and they have all good results. It's certainly a very common operation. If you think that 50% of men in the world are circumcised, it's definitely nothing new, but it's something that can make a very, very big difference. Surgery is a day case procedure, so there is no need for admission unless there are complications, of course, and patient can go home in few hours after they have had the surgery. There is a dressing in place that normally needs to stay for 24 or 48 hours, and it is just a grease swab plus supporting swabs and some tape. It's not the easiest place where to have a stable dressing, so it is very common that it doesn't stay in place, and it can be a bit upsetting because it needs to be refashioned. But after 48 hours, patients can get rid of the dressing and can leave the wound exposed, and in one more day they are also allowed to have a shower. Bath is not recommended for up to 2 weeks because the stitches are absorbable, and soaking them in water for too long would mean that they dissolve sooner, and that can mean that the wound gets opened and infected. After 8 to 10, 14 days, the stitches start to dissolve and they fall down spontaneously. And if everything goes right, after 6 weeks there is complete healing of the wound and complete recovery with all the activities that can be done.